Hi everybody, my name is Andy Kachor. I'm the Communications Director at NOFAS, the National Organization on Fetal Alcohol Syndrome, and I'd like to thank everyone for participating in this webinar, for attending today. Also, the webinar will be recorded and will be posted. The video of the webinar, including the slides and the audio of our commentary, will be posted on the NOFAS website within 24 hours after the conclusion of the webinar. That'll be at our website, nofas.org, and there's a button for webinars, and the link will be available there. Also, all the slides from this webinar will be posted as slides on the website within 24 hours as well. And the slides include hyperlinks to aspects of the NOFAS website, pages of the NOFAS website, as well as a variety of other web pages for more information. So you'll notice in many of the slides there are links. And so the slides will be available. The links will be active to click on in case anybody was curious about that. So the webinar is going to be presented by myself as well as Kathy Mitchell, the Vice President and spokesperson for NOFAS. So I'm going to be presenting the first half of this webinar, and then I'll turn it over to Kathy about halfway through. And people are very welcome to ask questions of the two of us after the conclusion of the webinar. So the presentation, we're planning on going till about a little bit before the end of the hour, a little bit before 3 o'clock, and then saving time for questions. So feel free to type in your question at any time in the question box in your GoToWebinar system, and to ensure the greatest likelihood of the question being answered, just make sure to type your question as soon as possible so that we'll have time to get through those. All right, so I'd like to now just proceed to go through the objectives quickly. The participants will learn about the existing resources available for families living with FASD, and get information on FASD diagnosis and what to do next, and learn how to access many of these resources that are available, as well as learn about the free and low-cost materials and resources that NOFAS is making available, many of which are available from NOFAS as well as other sources. All right. So just a brief overview about NOFAS is that NOFAS has been around for 26 years, and our mission is very simple: to prevent FASD, raise awareness about the risk of prenatal alcohol exposure, and support individuals, families, communities living with FASD. So NOFAS is dedicated to preventing FASD through public awareness and other means, as well as providing support, resources, services for individuals, families living with FASD. And though this webinar is going to review many of the resources that are currently available, and there are many materials available. As we all know, unfortunately, they may not meet every need, and the purpose of this webinar, though, is to go through the resources, materials that are available, and to point those out to people, and hopefully many people find that useful. So just again, as part of the introduction, it's very oftentimes easier to find information and materials such as documents, brochures, booklets, things of that nature. That's often more readily available than to find a local FASD-informed service provider. That's often one of the largest challenges. So NOFAS has a resource directory and other tools for locating FASD-informed service providers. But also, basic fact is that families often need to become experts in locating FASD-informed service providers and educating themselves about FASD. So to go over the resource directory, one of the key components of the NOFAS Information Clearinghouse is that we have a directory of resources listed state by state. So if you go to the website, nofas.org, you can find this resource directory. Again, this is one of the first slides that has what you can see is a link here. So we're going to make these slides available on the website. You can go and actually click on that, and that'll actually take you to the resource directory webpage to find out more information. So essentially, you'll go to that webpage, you'll see this map, you can click on any state, and you'll have a listing of local FASD-informed service providers and others in your locality. Right now, the categories that we're working with for the resource directory, it's broken down into diagnostic services. We also have treatment services, which are essentially direct services. And there's also advocacy support, so that would be legal support, things of that nature. And there's also support groups and family contacts. So there's actually a lot of parents, caregivers, other family members that actually have their personal contact information available to people that are living with FASD, and other parents and caregivers that want to reach out and connect to an individual person for information. And also there is information on alcoholism, addiction. That's essentially prevention, so that people can work towards preventing FASD and get treatment if they, or a woman of childbearing age that may be consuming alcohol during pregnancy. And on the right side of the screen there you see a sample page. This is for Indiana, and so we have at the top the NOFAS affiliate in Indiana, NOFAS Indiana. It's also broken down to category diagnosis of FASD. This page continues if you scroll down. That's just a sample screenshot there, just to give you a sense. And also, we're currently in the process of updating the NOFAS resource directory. So this here is a sample page of what the new updated resource directory search form is going to look like. So we're working on that, and essentially what you'll be able to do very soon, working towards getting this all implemented later on this year, or within the next year, is that you can actually input your zip code and you can filter by category, diagnostic services, or other types of resources, so that you can get a more customizable form of resources. So one of the key resources that people ask NOFAS about is the parent support groups. So many of these parent support groups are available in the NOFAS resource directory. If you go to the resource directory, click your state. Also, you can go through members of the NOFAS affiliate network. So more on that is, here's a map here of many of the places where NOFAS has an affiliate. So the NOFAS affiliate network is essentially a coalition of different community organizations dedicated to FASD services, and these affiliates range in size. Some of the affiliates are quite large and substantial and really do a great job of comprehensively covering their entire states. MOFAS, as an example, in Minnesota, has very extensive statewide services for people living with FASD. The affiliates range in size. Some of the others are more smaller grassroots organizations that were started by individual parents or caregivers, and that primarily have a parent support group, and that also compile a list of resources that are available to people. So there's affiliates across the country, and it's definitely helpful to get in touch with the affiliate nearest to you as a starting point. NOFAS has over 40 affiliates that provide resources to families in their geographic area. Here's just a sample of the MOFAS Minnesota NOFAS affiliate has a resource directory where it's searchable, you can search by zip code and so on. As an example, several of the other affiliates of NOFAS have their own resource directories as well. And the first of a few of the slides that we have just for different considerations is that dealing with uninformed providers can be very frustrating. So on that topic, you can search the NOFAS resource directory or contact a NOFAS affiliate to locate FASD-informed service provider. And as I said, the families often need to be the ones to inform the provider about FASD. So let's just talk a bit about the process of getting an FASD diagnosis. Diagnosis is a starting point, really, for meeting FASD-specific needs. We at NOFAS, through the years, have found that it's really helpful to actually get that diagnosis. Oftentimes there's can be barriers to getting it, such as a lack of sufficient diagnostic capacity, maybe financial barriers. There may be other issues like that, but it's definitely, we found that the families in the NOFAS community that actually have a specific diagnosis of an FASD, of one of the diagnostic criteria under the FASD umbrella, that's very useful as far as finding services. So you can use the NOFAS resource directory or some of the affiliates' resource directories to find a diagnostician, get that formal diagnosis. There's also this document that's guidelines for referral and diagnosis that has some really in-depth detail that really goes in depth on that. And we're going to make these slides available, and the slide, again, is going to have a link to that actual document. You can click on that and read all about that. And there's the services for affected individuals and their families. It walks through the steps of getting a diagnosis. This slide is essentially about reimbursement codes. So this is information really that medical practitioners should have, but often are uninformed about FASD, so oftentimes the families actually need to know some of this information to help get services. So FASD is included in the DSM-5 and the ICD-10. So the DSM-5 is Diagnostic and Statistical Manual of Mental Disorders, so that's used for mental health services. So FASD now in the latest version does have a code that parents and family members, people with FASD, can give to their mental health care professional for reimbursement of services. So that's important to have. And also the ICD-10 CM just came out as of October 1st. That also has some codes for services relating to some of these conditions under the FASD umbrella, and families can find those codes helpful in terms of getting reimbursement in their insurance plans for medical services relating to FASD. So again, the slide will actually have the link here where you can click on and get more in-depth information. Okay, so the DSM code 315.8. Also, there's an intervention brochure that NOFAS developed along with the CDC that has a list of 4 programs that work. So this is a great brochure. NOFAS is happy to send out this brochure free of charge. If you can go to the NOFAS website and just contact us. This brochure lays out 4 specific programs that are evidence-based interventions to treat people with FASD. That includes a program called PACT, Parents and Children Together, a program called Families Moving Forward program, Good Buddies, and MILE, which is the Math Interactive Learning Experience program. And more details on all that is available at this link, and the brochure itself is available actually just to download as a PDF to your computer, and we'll also send you a paper copy if you'd like, and you can order bulk copies, multiple copies through the NOFAS website as well if you'd like. And 8 Magic Keys is a great DVD that NOFAS has available. That's strategies for students with FASD, and that's a short animated video that was developed by the Anchorage, Alaska School District, and that goes through 8 magic keys. So those are 8 strategies for students with FASD in school, and that goes through a lot of specific ways to intervene with students with FASD in the classroom. So it's very specifically focused on classroom. That was developed also by Deb Evenson, Jan Lutke. Jan Lutke and Deb Evenson developed that. So that DVD is available from NOFAS, and it's a short, fun video with some really useful information. Another consideration that I'd like to go into is it's important to not limit your search for FASD resources only to those resources that specifically reference FASD by name or labeled FASD. Later on in this webinar, we're going to go through a large variety of resources that are specific to FASD. And it's important, though, to keep in mind that there are organizations such as disability rights groups, special education advocacy, general housing assistance, general employment assistance that NOFAS has found and has heard from parents with children and adults affected with FASD are very useful, even though they might not have FASD in the name. So some of these groups are great to reach out to in addition to the resources that have been developed specific to FASD. So it's just important to cast a wide net in searching for resources. Another thing, sharing personal stories is something that we found to be very helpful in terms of having people with FASD feel like they are not the only ones affected, like they're not alone. NOFAS has an interview series on the NOFAS website called Get to Know Me. And what we do is we interview people over the phone and then transcribe those interviews. And they're on the website. We just, in the last week, posted an interview from a 34-year-old woman named Rebecca. And she was just recently at age 34 diagnosed with an FASD, and she shares her story. She's actually a very successful insurance company professional, and she has a very interesting perspective. There's a wide range of stories. These interviews, the people that are interviewed range in age and background, and it's just a great resource for people to hear about what it's like for other people to live with FASD and to feel like they're not alone. So there's people from across the spectrum. That's helpful. Also, NOFAS has produced many videos, about 200 videos that are on the NOFAS YouTube channel, which is called Alcohol-Free Pregnancy. And there's a link in that slide. So if you go to the nofas.org website, there's a tab for videos. You can go in to our NOFAS YouTube channel. Many of these videos are actually interviews with people affected by FASD that share their experience in their own words. And again, that's another tool like the Get to Know Me for people to feel like they're not alone. There's also a lot of interviews with FASD professionals, people in the field. This screenshot here is a list of the most viewed videos from the NOFAS YouTube channel. So you can see there's several videos that have many thousands of views. Interviews with birth mothers of children with FASD, children and adults living with FASD, as well as PSAs, interviews with doctors, researchers. So all that is available to view as well. And NOFAS also has 3 DVDs that are available. We have this DVD called In Our Own Words, which is children and adults living with an FASD. This video is really a compilation of many of the videos that NOFAS has produced of people that are individuals living with FASD talking about their experience, what it's like in terms of getting the diagnosis, or at different ages, different experiences, a lot of emotionally powerful, resonant material there. Also, the 8 Magic Keys, which I mentioned, is available from NOFAS, and also a DVD, Recovering Hope, which is about birth mothers talking about FASD and working to prevent FASD. So that's also available from NOFAS. And some legal resources. NOFAS has a dedicated webpage for criminal justice legal resources. The link is in the slide. It has information, resources, it has some videos, some webinars with some of the leading legal experts in the field. Also, a lot of leading legal and criminal justice organizations have their own specific FASD resources, such as the American Bar Association has an FASD resolution. There's an organization called FASD Experts, which is a team of forensic professionals that can work to be part of a defense team of an individual with FASD that's in a criminal proceeding, for example. They have those services, very specific training to FASD. Also, the ACLU, the National Disability Rights Network, has some information. And in this slide, these links point to those specific pages with some more information there. And another consideration I'd just like to mention is it's often helpful to look into support for other developmental disabilities that people with FASD may also have, such as ADHD services. Treatment that, again, is not specifically labeled for FASD can often benefit the individual in a holistic way and indirectly help their FASD-related issues. So even if it's services is not labeled specifically for FASD, that often can have a positive effect on the individual themselves living with FASD. So just wanted to make that point. And now I'm going to turn the presentation over to Kathy Mitchell, the Vice President and Spokesperson of NOFAS, to talk about a lot of specific resources that are available for parents that are on the NOFAS website and other websites.
Good afternoon, everyone. Thank you so much for joining us. And if you have questions, we are going to be taking questions at the end. So just type away and we will get to those answers for you. So we'll leave plenty of time for that. So, you know, one of the things that NOFAS is always working on is our website and having resources available for anyone and everyone who has any interest whatsoever in fetal alcohol spectrum disorders, whether that's teaching children, resources for adults, preventing FASD in school populations or in communities or special populations. And, you know, maintaining a website for a small nonprofit like NOFAS, I actually liken it to dirty laundry. It's never ending. So any given day, there are resources, new resources in various states or territories, new materials that have come out from different organizations, or people that have left the field and are no longer there but are listed on our resource directory. And we really depend upon all of you to let us know when you come across some great materials, or you find a great provider in your community, or you find that you've tried to use a provider and didn't have great success. All of those things are important to us to stay up on. And at NOFAS, we work a lot with our interns, a lot of them from Georgetown University, that's kind of in our backyard. So a lot of the materials I'm going to share with you today have been identified by a lot of our interns. So we keep them busy researching for new materials. So we'll go through some of those now. And again, this is just a snapshot of some of what is going to be available. Some of them are currently available on our website. All of them will be available by going into the webinar after it's posted, because they're all going to have links to the various resources that are mentioned here today. But there are many, many, many more that are being prepared for new web pages on our new website. So again, and we categorize the resources in a variety of ways. So we've got resources that may include tools for parents and caregivers, by prevention, by addiction and treatment. But how do I move that? Good, thank you, Andy. Yeah, sorry about that. So that is changing as well, and that's always a struggle for us, by the way, is trying to determine the best way on our homepage to make this very user-friendly, especially for our parents. But what I thought today is I wanted to just go through some of the resources that I find very helpful when I'm talking to parents, and most of these I'm really familiar with. Some of them I'm not as familiar with, but certainly may be very useful. So Triumph, this was created by the Double Arc, our NOFAS Ohio affiliate, by by Sister Suzette Fisher, and she has done a beautiful job. It's got, I believe, 6 modules, separate modules. She actually teaches this hands-on, and I've known a lot of parents that have gone up to her facility, and I believe it's a 2-day training. It may be 1 day, but anyway, she does offer that. Typically, I believe it's once or twice a year, and we always let people know through the NOFAS Roundup. And by the way, the NOFAS Roundup that comes out every Monday, our electronic newsletter, Andy Kachor is the editor of that. That is a fabulous resource if you want to stay up on everything that's new and everything FASD in the whole world. Andy does a fabulous job of collecting that information and getting it out there. You can also purchase the Triumph, and it also comes with a parent workbook. Now, another curriculum that I am crazy about is the one that was put together by our South Dakota affiliate, and it's FASD Education Strategies. This is a really comprehensive curriculum, and they have just done a beautiful job. If you don't have a copy of this, I would definitely seek it out and obtain it. We have a hard copy here in the office. They've done a beautiful job of going through these lesson plans, and when they're very specific to a certain age group, they actually have little icons that will talk about elementary, middle, or high school. And of course, we know that when we're talking about individuals with FASD, oftentimes it's really not the age, but their developmental age. And I think they've done a really good job of addressing that. Our Kentucky affiliate that was being led by Laura Nagel, who has since gone on to another venture. She's just this, if you don't know Laura, she's just this remarkable woman who is so talented, and she did some incredible work in the area of prevention in her state. But one of the things that she managed to publish is the All About Me booklet. All of her materials are available. Again, you'll find the link on the webinar after, I guess that comes up tomorrow at some point. But the All About Me booklet, it actually, you know, when we published the FAS book for parents and caregivers many years ago, I guess it was over 15 years ago, the FAS Practical Suggestions and Support for Family and Caregivers, I had included creating a personal profile as one of the things that families could do to help educate teachers and other providers. And that's basically what the All About Me booklet does. And it helps to create something that's very personal, that helps others get to know your the student or your loved one very quickly. And I still use that. I think many of you know me, and I have a daughter who is now 43 years old with FAS. Developmentally, she's probably more around 6 years old. So as different community support people come in and out of her life, we still use that personal profile to help to educate folks so they understand Carly. Now, Andy had mentioned our brochure, our intervention brochure, which we tried to keep very upbeat. We named it the Hope for Children with Fetal Alcohol Spectrum Disorders for Programs at Work. And one of the programs listed in that is the MILE program, which is teaching children with FASD math. And again, these are all manualized. So you can go online and obtain the manuals to use these, to provide these to your education system, to your children's teachers. And they also offer live trainings to train teachers and other professionals on the MILE program. So again, it's a wonderful example of what can be done when teachers work not only with students with FASD, but also with the parents. And I will tell you that every one of these evidence-based programs that are listed in that brochure all include the parents and the students with FASD. We listed some other things that we found online: practical money skills for life, and math is fun. So we have a whole listing of other materials that might be useful for those of you that may be raising children or even adults with an FASD. Some of the things that we identified to address attention issues are included here: attention building, games for children with special needs, and 15-minute activities, so storytelling to problem-solving activities. Some of the social skill building programs that we identified, well, certainly are two that we're very familiar with is the Families Moving Forward program that Heather Carmichael Olson, or is it the opposite? I have to look. It is. I got it right. I'm perfect. So yes, Heather from UCLA had, from Seattle Children's Institute at the University of Washington, had developed this program. She has a manual on this, and she also provides live trainings for families. And basically the premise to that program is a counselor comes into the home and works with the families so that they can begin to address some of the stumbling blocks or problem areas that families may be going through. The Good Buddies program is Mary O'Connor's baby, and again, that's out of UCLA. And Good Buddies is part of this Bruin Buddies project that Mary had developed years back. But basically, it's teaching children with FASD how to make friends. And again, you're bringing the families together with the students to work together on social skill building. And we also found another link that we thought looked pretty interesting. It's called Improving Social Behavior. And again, you can, it's got the hyperlink to that. To address some fine and gross motor skills, we identified many programs that were available online, and we just included 3 here. We thought the monster punching bag looked pretty interesting, so it's something that you can build at home, and really teaching kids how to kind of work through some of their aggressions and giving them sort of a positive way to deal with that. I actually saw something on the news last week in one school system, I believe it was in California, and they have a program where they have the kids that have ADHD meet in the morning at the schoolyard, and they all go on a bike ride for an hour, and it's a program that one of the teachers is running, and they've actually been monitoring the children's behaviors throughout the day, and they were talking about it being just a highly successful program. So again, thinking kind of outside the box, ways that we can work with kids that have some behaviors that need to be addressed in many different ways. There's also certainly a lot of OTPT website that have all kinds of activities that will promote both fine and gross motor skill development. The PACT program is Ira Chasnoff's program that looked at emotional regulation, and again, working with the parents as a team along with the child, helping the child to identify when they were needing help. When I believe it was, how does your engine run, is the language he uses. But he used to, I'm not sure that he still has, he used to have some videos on his website. But again, part of that CDC funded research that's included in the intervention brochure and has been found to be highly successful with children with FASD. And other strategies that we found a blog on strategies to help kids calm down. And there's other scales and tools and techniques that have been developed by OTPT experts. One of the ones that had really high ratings was the incredible 5-point scale. Again, helping children, much like when you probably all have seen the scales of the pain that they use in hospitals. You know, how much pain are you in, looking at children's faces. It's very similar to that, so that children can identify, you know, where their stress is by facial expressions. And again, there's a listing of some fall sensory activities, things, of course, like raking leaves, jumping in leaves. And there's even a site that I thought was pretty interesting, but again, getting to this kind of chores and heavy work activities that really do help to reduce aggression in children. And we included some family and teaching activities, time to, resilient families that deal with individuals in their families that have special needs. It helps to have structured activities at some point during the week where the families can sit down and try to have fun together, have a good time. So we included some, I think, pretty good examples here. And I really like the restaurant waiting games for kids. Again, when we're taking, our loved ones out, we need to predict that it's going to be stressful. If we're taking them to an assessment and there may be a long time waiting, it's having a lot of these things pre-planned that we can interact with them and kind of reduce the occurrence of the meltdowns. We found a zillion apps, and again, there's not many apps for FASD. Of course, the CDC has an FASD app, but that's not really designed for family members per se. But we found lots of apps that can be downloaded, many of them free. But if you start to Google around with some of the issues that your children, or I'm saying children or adults, are dealing with, you can certainly come up with some great ideas. Many of them were designed for children on the autism spectrum, but there's just a lot of good stuff out there, and we have a list, I believe, of maybe 100 apps that will eventually all be on our website. We're just taking the time to go through all of them, is spending more time on them before we're going to list them all. And then we also included, again, some craft ideas, having structure. Of course, we included, some fun Halloween crafts. But, you know, I know that my 43-year-old still loves to do crafts, and I know many adults living with FASD that still enjoy doing lots of art activities together, and it's a way to pull the family together and do something fun that everybody can feel good about. Our goal is to get more materials as they become available for high school students and transitioning youth. We included some here. I have the real gift of working here at NOFAS and being able to attend the University of British Columbia FASD conference every year. And every year they alternate between having a research conference to addressing a conference for older youth, transitioning youth and adults. And it's a really great conference, and it's really where I find all the gems because Canada seems to just be at least 20 years ahead of us in terms of having materials together. One of those is Bridging to Adulthood, a protocol for transitioning students. And I don't even know if this is on here or not, but Supporting Success, maybe this is on another slide, we'll see in a moment here, but Supporting Success for Adults with FASD, put out by Community Living, okay, in British Columbia. It's a really great resource. And some of the other ones here that are listed here, I guess one is an audio podcast. You might check out. I have not actually had the time to check that out. So we have a website, and again, Andy knows more about these things than I do, but we do have web pages for on various topics that you'll be able to research through. And again, a lot of this is under construction and just continues. We're continuing to add more and more to. There it is. There's that book at the last bullet point. That's really a great booklet. I would highly recommend getting that. The SAMHSA network was something that was funded by SAMHSA's FASD Center for Excellence. The National ARC had received that funding. That funding is no longer there, but from what I understand, the ARC still maintains the SAMHSA network. So you can find the network on the ARC's website. And we do have a web page on housing. Now, I don't know exactly what's there. Of course, if anybody here has an adult with an FASD, that is really tough. And what we find is that you have to, in most neighborhoods and most communities, you have to find find a way to be innovative and creative. If you're lucky enough to have DDA funding, maybe to find a good match and create housing environments. I know that there is one of our affiliates that is working on housing, and maybe Andy can talk about that afterwards. I'm not really up on the news with that, but and Dr. Rod Densmore wrote a beautiful book and has DVDs, FASD Relationships, what I've learned about FASD so far. He has a daughter, a beautiful daughter, living with FASD. He is a beautiful human being and very approachable, and it's something that I would have in my library if I didn't work here, if I didn't already have it through NOFAS. There's a handbook called So You've Been Diagnosed with FASD, Now What? That's another really great piece to have. So again, we have lots of partners. They're not all listed here, but we work with all of the government agencies charged with addressing FASD. And we work with many nonprofit organizations and certainly all of our affiliates. And a lot of our affiliates are, very recognizable nonprofit organizations. There's resources available from the CDC. Again, they mostly focus on prevention because they're the Centers for Disease Control and Prevention, so it would make sense. And of course, our funding that comes from CDC is all about prevention. So that's what we work on with any of our work with CDC. They have a whole curriculum that was developed for medical and allied health professionals and students, and it's been completely revised, and that's available online with all of the different competencies. SAMHSA's website, SAMHSA's FASD Center for Excellence, has a beautiful website, and they have just everything, grab and go. I mean, most of their resources has gone into their website, especially this past year. A lot of their funding was cut, but they really just focus on their website. So it's something you have to bookmark and to visit often. And we do feature a lot, everything new that they're doing. Again, the SAMHSA tip, the treatment improvement protocol, tip number 58 on addressing FASD was written for providers to teach them how to address FASD. So this is not only useful for mental health professionals, it's useful to give to teachers as well, to anyone that is, caretaking or assisting your loved one. So, and it gets into a lot of adult issues. So I think it's something you can order for free from the clearinghouse. You can get an electronic version or a hard copy, and I would definitely recommend getting several of those that you can share. You can copy pages, it's in the public domain, to provide to different folks that might be working with your family members. The Circle of Hope, I believe I have a slide on that, so I'll come back to that. So I have slides on all of these. So let me just get a little bit into prevention, because some of you might be attending to find out where to get free or very low cost materials. So for those of you not familiar with the Circle of Hope, we are national, now international. There's a Circle of Hope in Australia, one in Europe, and one in Canada. So our Circle of Hope is a prevention program designed to support women that might be new in recovery so that they won't drink throughout the next pregnancy if they get pregnant again. So we mentor women if they're struggling, if women are in recovery or not drinking, or maybe they're not even, didn't ever have a dependency to alcohol. They help mentor women and help to go out in communities and tell their stories. We find that the birth mother story is very powerful with the media, because these are people that have drank and have to live with the guilt and remorse and the knowledge that something they did during pregnancy harmed their own child. So we do have materials on this. We would love for you to tell people in your community. If you happen to work with women who might be drinking, let us know. We're there to support them. We have monthly calls and try to connect with women as often as we can. And we spend a lot of time, by the way, getting women that call here that might have been drinking, that need treatment. We help get them treatment. So there is treatment in the United States. There's treatment for pregnant women, and there are treatment centers available for women with children. And we will go the extra mile to get those women the help that they need. And it's all in the name of preventing FASD. We still have our K through 12 prevention curriculum available. So this curriculum is about preventing FASD. This is not about teaching children with FASD. So there's 4 modules. It's very low cost. I believe it's maybe $85 for the 4 modules. It was this was piloted. It was funded through the CDC, and it's very user-friendly for families. We also, of course, most of you probably know that FASD Day is September 9th, and this year we rolled out the first ever FASD month in September, and our goal is to get FASD month list it in the healthfinder.gov. Healthfinder.gov does not list days. We want it to be listed with all of the other disorders or diseases so that people are aware of it. We have many, many, many materials available. When you click on that link, you will find that there on our FASD month webpage, there are free posters you can get from NOFAS. There are postcards you can get if you want to do a mailing to like all the physicians in your community or all the teachers in your school or what have you. We want to work with you to support you to get the word out. So anybody that's willing to disseminate our materials, boy, we're more than willing to help you get those out. By the way, one of the things I neglected to mention is the CDC also has a beautiful brochure. It's very current. It includes the fetal development chart. These things are all free that you can get through NOFAS. This year we also rolled out the Stamp Out Stigma campaign, which is really focused on the stigma against birth mothers, but also the stigma against individuals living with an FASD. One of the things we find with social media is that, you know, oftentimes these anonymous bullies, if you will, come out and say very hurtful things about birth mothers or about people living with FASD or families. And one of the things we know is that until we really tackle this issue of stigma, we're not going to have doctors wanting to diagnose people with FASD because they don't want to upset the mother, they don't want to hurt her feelings or the families, they don't want to label the families, they don't want to label the child, all of these things. There's a lot of complexities to this issue, and we're actually going to be having a whole webinar to begin to tackle this. So our thoughts were, let's start talking about it. If you go to that webpage, you will find a change.org petition. We're asking people to sign that and also to send photos of themselves, letting people know that they join NOFAS to stamp out stigma. We also work with EuroFast and several other partners from Europe on a campaign called Too Young to Drink. This initiated in Italy. It's not language that we would have necessarily chosen. It doesn't really resonate here in the U.S. Because we have the too young to drink issue of the drinking age and that sort of thing. But the bottom line is, on September 9th, we are a major partner with this group. This past year, we had 60 countries participate. And at 9:09 a.m., oh, okay, we had countries from around the world holding their materials up in front of notable places. And sometimes the places were a very small clinic in South Africa, for instance. And it was really something to see. So using social media, we do Twitter chats, we work with this campaign. We do have postcards available that you can purchase that have the image there of the baby and that you can use, again, if you're having some sort of a community event and you need materials. But if you want to join with us to participate in the campaign, your logo and your agency would go up on the website. So now we have questions, but I am going to do something that I was thinking as I was talking that nobody knows that I'm going to do. But what I am going to do is to say to you that have participated and joined with us today on this webinar, if you want any of the NOFAS materials, Andy talked about the DVDs. By the way, the best DVD, one of the ones that you should absolutely have in your library would be 8 Magic Keys. It is an amazing piece that is a great way to teach lots of folks about how to address, how to prevent some of the behaviors associated with FASD. And certainly the other DVDs are absolutely great. All three of them are great additions to any library. We also have A Child for Life, another good piece. But any of our materials that you would like to order, if you order them before Friday, close of business our time, 5 o'clock p.m., you can get them for half price. So just you can email Andy Kachor or myself, mitchell@nofas.org, or just say, I attended the webinar and I'd like to order the following materials. So just let us know that you would like the materials and we can send them to you half price. So now I am going to stop talking and turn the mic over to Andy Kachor, who has a question. He's going to read.
Okay, hi, yeah, this is Andy Kachor again. So again, just to remind everybody, all the slides from this webinar presentation will be made available on the NOFAS webpage within 24 hours. You can go to nofas.org and click on webinars. And then in the slides, there's a lot of links that will be active to go to various web pages that were referenced in the presentation. So we have several questions, and definitely, if people want to, there's time to have a few additional questions. People have them. So I'm just going to read this one question that we got, where this person said that they adopted 3 siblings from Russia, and they have a diagnosis of an FASD on one of the twins, and they have a neuropsych report that they brought to the county to get services for that individual. And they did their own testing and determined that she was not able to get services, that she was 4 years old, and this parents sat in the testing and coached her. She was saying, so put her in a private OT speech and private preschool, and this person's question essentially is, what does it take to get services from public schools? And so I'll just turn that over to Kathy.
What? Okay, sorry. We have many questions. I was busy reading questions. I thought you were going to take that one, Andy. So they're asking, someone's asking about getting services from public schools. Well, it would probably be better if you called me on the phone and talked to me about it, because it really depends on where you live. I've known many people that have had to hire lawyers, but I would probably start with, and this is a public school in the U.S. Yes, they're in the U.S., I'm thinking. But if I were you, I would start with the principal and your children's, or you have 3 children, okay. In Arlington, Virginia, okay. You can certainly contact us, and we can certainly be helpful with that. And the woman that I know that had to hire an attorney, I believe, was also in Arlington, Virginia. But, what you want to do is sit down with the principal and with the teachers and talk with them about your child's needs. I think that's a good starting point. Maybe you've already done that, I don't know. But certainly we would be more than happy to provide you with the information. You want to come in armed with the facts, with the research, and let them know where your children's deficits lie and what their needs are. And you may need, there's professionals you can seek out. Again, it's always helpful to have very current scores, like adaptive functioning scores. And because your children, I don't know your situation, but again, if they have an IQ, a higher IQ, and they struggle in certain areas, that may not really be clear until you show them those reports. So those are some of the things you want to come armed with. But it's always better to sit down and have a conversation first, and then go from there, filing grievances and going through that process. But we do have experts we can line you up with, and we are a little familiar with that area. So.
Great, thanks. This is Andy Kachor again, so I'll just take this next question, which somebody was asking to explain the difference, talking about the NOFAS affiliate network, just to explain the difference between an affiliate and a chapter and how they can work with NOFAS. So yeah, essentially the affiliate network is really a coalition of different autonomous organizations. So they're not chapters in the sense that they're not directly run by NOFAS. So each of the organizations, the affiliate network, they're their own organization. They have their own nonprofit corporation status. and they're part of a coalition as part of the affiliate network to share resources, to communicate. There's an annual affiliate summit that NOFAS puts on in Washington, D.C. But essentially, each affiliate is its own organization. And some of them use the NOFAS name in their name, and some don't, but they're essentially their own organization. So that's kind of the difference there. And NOFAS does have an application. If organizations are interested in becoming an affiliate, you can just go to the website, nofas.org. There's a link for affiliates, and on that webpage, there's actually a document that you can print and fill out. There's an application process. If you want more information on that, on becoming an affiliate, you can just contact NOFAS. Go to the nofas.org, contact us, because somebody else was also asking about potentially starting an affiliate organization in Florida. So that's great. NOFAS, would love to have additional affiliates. There's an application process on the website. You can contact us for more information. And yeah, I'll turn it back over to Kathy.
Also in Florida, I don't know where in Florida you are, but there is a group in Sarasota. They have an FASD center there, and Catherine Shea is part of that group. If you're anywhere near, or you might just contact her anyway, she's been wanting to start an affiliate there. Somebody asked about getting a certificate of attendance, and if you attended this webinar and you do need CEUs, and it's through NADAC, which is the National Association for Addiction Providers, we can provide you with that certificate. So, and that's our good friend Shirley, I see, is on today. Hi, Shirley. And somebody asked about homeschooling, and I just wanted to say, if I was going to homeschool my child, I would start with getting that South Dakota Education Strategies. I would get the Triumph. I would contact Sister Suzette in Ohio and attend that session, that live session, if she's having that anytime soon. And there's such great materials also available through the Center for Excellence. I'm sure we have many others available with the fact sheets and whatnot, but I would definitely get both of these, because they're just chock full of great lesson plans, and I think you'll find them very useful.
Hi, this is Andy again. So we got a question. Somebody was asking how they can volunteer to be interviewed. So NOFAS, yeah, great to welcome you to be interviewed. We have the Get to Know Me series. So definitely you can just contact NOFAS. And what we do is we would set up a time to have a phone conversation. And I'll send you all that information. And it's for anybody that is living with an FASD to share their story. And so you could just go to nofas.org, you can contact us. You could also email me directly if you'd like at Kachor@nofas.org. That's Kachor@nofas.org, or just go to nofas.org, do the contact us form, and we would set up a phone interview, and then that'll be transcribed, and we'll send that to you. Just make sure that you're comfortable with that, and then we can post that story on the website. So thanks for that question. We appreciate it.
Okay, and Florida question. We had somebody come back that's in Tampa. The Florida Center for Early Childhood, contact Catherine Shea, 941-371-8820. As for Colleen Chamberlain, and they do great work. By the way, somebody had asked about some of the evidence-based programs in our intervention brochure that I had talked about. I do believe, if the individual's still there, that the Florida Center for Early Childhood does offer, and they're telling me now, yes, they do, the Families Moving Forward. So if you cannot find someone in your area that is trained on any of those programs, you can get in touch with us. And I do see here our friend Gigi Davidson at 808-523-8191. She's the founder of FASD Communities and, of course, an affiliate. That's who I mentioned before. And I could not recall the FASD community's name. I apologize, Gigi. They are doing a beautiful job across the nation trying to get funding to open houses for individuals with FASD. So I don't work hands-on often with the communities, with the affiliates, I'm sorry, and so I forgot the name of your group, but it's FASDcommunities.org, Gigi Davidson. And with that, I think we're out of time. You can, again, email me at Mitchell, MITCHELL, at nofas.org, or Andy Kachor, KACHOR, at nofas.org. If you have more questions, and we'll be glad to get the information out to you. And please stay informed, visit our website often, because we are making very significant changes all the time. So.
Yes, thank you, everybody. Again, a lot of this information is on the NOFAS website, and the slides from this presentation will be made available on the NOFAS website at nofas.org, and they're under the link for webinars. And the slides themselves will have links to pages on the NOFAS website and other web pages that were referenced. So we're definitely going to put that out there, so look for that. Also look for the recording of the webinar, which will be posted in the same place that you registered on the webinar page under nofas.org. And while you're on the NOFAS website, we definitely encourage everyone to get connected with NOFAS on social media, on Facebook and Twitter. We have an active presence there. We can get updates and information, and also you can sign up for the NOFAS Weekly Roundup, a weekly email newsletter that has the latest information and resources on FASD, just to stay informed on a regular basis. That comes out every Monday, every week, and has the latest FASD news around the country, in the media news reports, the latest research, the latest community news, people living with FASD, resources, additional future webinars, all that kind of thing. So you can sign up for the weekly roundup at nofas.org. There's a link for that as well.
Thank you. Have a great day.